Hello, everybody. My name is Perry Gee, and I'm a nurse scientist for Intermountain Healthcare. And for the last several years, I have been studying um, nurse well-being. And right now, during this COVID-19 pandemic, is a time where we really need to put our best foot forward and do what we can to help nurses. I'd like to introduce to you a good friend of mine and colleague, Dr. Renee Thompson.
Yeah, thanks so much, Perry. My name is Renee Thompson. I've been a nurse for a really long time. And I always say I've done pretty much everything that you can do as a nurse. And you know what? About 10 years ago, I started to realize that it didn't matter where I worked, whatever organization, it didn't matter what I did, what role I had. I swear there were always a group of people who made it their mission to make my life difficult. And I really started tackling this topic of bullying and incivility in healthcare because I got to the point where enough is enough. And, especially recently, we've been looking at COVID-19 and the added pressures and stress that we're all, going through in healthcare. And we're seeing an uptick in disruptive behaviors, I think, because of it. And Perry, I think this is really where you could be a great resource for nurses because you understand all the science behind burnout and then what we can do to be more resilient. So I'd love to just kind of pick your brain and find out or, share with us what you've learned about this topic.
Appreciate that, Renee, and thank you so much. And yes, frankly, burnout has been studied scientifically for the last 40 years. Dr. Christina Maslach out of the University of California studied it for years and studied nurses in burnout. And I just completed a study of over 3,000 nurses. And in that study, over 50% of the nurses were experiencing burnout. 28% had severe burnout. And this is pre-COVID. So this is something that I'm very worried about, Renee. And the other thing that happens, we see in the literature related to pandemics is PTSD. And about 15 to 20% of nurses already have a baseline level of some level of PTSD. So we have burnout and PTSD together. This is a real concern. Now, the one thing I want everybody to keep in mind, and I know that you talk about this as well, Renee, and that is burnout is not a mental condition. It's a workplace disorder. So there's nothing wrong with you as a nurse. I don't want ever to hear that anybody say, well, if you were just more resilient, then you wouldn't be burned out. I think that's very frustrating. It's very demeaning to nurses. Resilience, yes, can help us, but it is not your fault you're experiencing burnout. It's the fault of our healthcare system. And what is burnout? Well, burnout is emotional exhaustion. It's made up of three constructs: emotional exhaustion or just exhaustion. I just heard that in the meeting today. Nurses are exhausted right now during COVID. And that's a big problem. In fact, we're trying to find more help for them. We're trying to relieve nurses. I just heard a report today where a nurse just took her mask off in an area where she was exposed, and everybody was terrified. And they said, why did you do that? She said, because I'm just tired. So that's something we need to watch out for one another. Depersonalization or cynicism, you have a negative attitude. That's another thing that you might experience with burnout. And then reduced personal accomplishment. And it makes sense, right? If you're tired, if you're feeling cynical, it's going to be hard for you to accomplish good things. And the thing that's even worse in all this, and I know, Renee, you'll talk about this in just a moment, and that is the behavior change that we might see. So I might make that medication error that I never would have made. I missed the calculation on my medication. I never do that. I might yell at a coworker. I've never done that before. Or I might feel physical symptoms of insomnia or a stomach ache or a headache or tension or depression. All of these things are part of the behaviors we see with burnout. And so, Renee, can you talk a little bit about some of the behaviors that you've seen over the years with burnout?
Sure. And it's sort of funny. I never sought out to be an expert in burnout, yet so many people ask me for help dealing with burnout. And we have a program, and I do some workshops on how to go from exhausted to extraordinary. And here's, I think, why. It's because in general, when people are under high stress, nobody behaves at their best when they're under stress. And when people feel burned out, it's even harder to show up every day being positive and a professional role model to others when you're incredibly exhausted. Like, we know this. And it's interesting because when you look at bullying and incivility, we see more bad behavior in healthcare than any other industry in the world. And you might say, well, wait a minute, aren't we the compassion industry? Well, think about it. We see more stress in healthcare, or we experience more stress, the unpredictability of patient care, life and death situations every day. We don't always show up as our best when we're under a lot of stress. Well, think about COVID-19 right now. Even though the public is identifying healthcare professionals as heroes, we're seeing an uptick in bad behavior. Just like you said, Perry, you said, I never yell at my coworker like this. And I'm yelling at my coworkers now. So we understand why people might be showing up and misbehaving at work. And it stems from a few negative emotions of fear. A lot of nurses come into work putting themselves at risk, knowing they're putting themselves at risk to care and serve our public when they've got little kids at home, that they're afraid that they're going to expose them. They're worried about what's going to happen in their community, in their world. What about nurses who may be listening right now who aren't on the front lines caring for patients? They've been furloughed and now they don't have a job right now and they're at home. Some of them actually feel guilty that they're not out there on the front lines. And I know myself, I've been a nurse for almost 30 years. When this all happened, I said to my husband, I feel guilty that I'm not out there with them, putting myself at risk. But then, it's taking a step back and say, what can I do about it? So there is fear, anxiety, the stress, the unpredictability. We don't know what's going to happen. That has elevated our stress to a level that none of us have ever experienced in our lifetimes. And we're seeing more bad behavior show up, and it shows up as constant complaining, negativity, nitpicking. Oh my gosh, Perry, the nitpicking. How come she gets to do this and I can't do this? And how come she didn't have to change her schedule? And how come I have to be the one to go to the COVID-19 unit and it should be her turn? We're seeing a lot of nitpicking. And we're also seeing a lot of people making false assumptions about the decisions that are being made, a lot of times by their leaders, by their administrators. And, information is changing constantly about what mask to wear, what mask we don't have to wear. And think about it, people get stressed out when they're asked to change. Well, things are changing every hour at some points. And so all of that can lead to us showing up in ways that we're not being professional. We're not being sort of that professional role model that maybe we were in the past. And I do want to just give the audience here something to think about when they're faced with all this negativity. And Perry, I'm sure you know this. There's something in all human beings called the negativity bias. We basically think about 60,000 thoughts a day. 80% of them are negative. And it's built in us as human beings because it's a survival thing. Your hypothalamus is always out there on surveillance, looking for any potential threat. So we're designed to look for negative. And I'll give you proof of this. Let's say you go to a restaurant. Remember that thing we used to go to before? Like, we go into a restaurant, you'd sit down, get waited on, okay? And let's say you had good service and you say, I'm going to write a nice review on Yelp or something. And you walk out and you forget about it. But if you have bad service, boom, 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 you're blowing up your phone before you even leave the restaurant. It takes less energy to be negative than it does to be positive. So here's what I want you to do. Start looking for the goodness. Start looking for the good things that your coworkers are doing, the good things that are happening out there in the world right now, and acknowledge them, verbalize them, because the more we can do that, the more that helps tip the balance of all of the negativity that's out there right now. And there's another tip that I would give, and that is, just because we're in a global pandemic does not give all of us permission to be cruel and mean to each other. And I've heard this from a lot of leaders. Leaders, if you're listening to this, I know what's happening. Your employees are behaving badly, and you feel bad acknowledging it or reprimanding them because you understand it. And that right now is going to set us up for problems later on. So this is what I encourage you to say to your coworker. If you're a leader, say this to your employee. Look, it's okay to be angry, frustrated, upset, afraid, anxious, whatever it is. It's not okay to be mean. It's not okay to be cruel. Neither you nor I have any extra energy today to spend on nitpicking, blaming, okay, blah, blah, blah. Today, I need you to be like your very best so that we could serve our patients today. So it's trying to keep your frame in today, this moment, not what might happen tomorrow, the numbers a week from now, what's going to happen 6 months from now, because that just adds to burnout.
That's great, Renee, and I really appreciate that. And you know, I appreciate your message of kindness. You've been very consistent with that message. Perfect over the last years, and it does make a huge difference. Some of what you're talking about, when you talk about being in the moment, is being present. And we know that mindfulness is one of those things that can help during a pandemic, that can help with build resilience and reduce burnout. So that would be something I would encourage people to look into. Look for resources at your facility. Maybe contact a chaplain or your manager if you're concerned or worried. Many of the professional organizations, especially nursing organizations right now, have resources out there available for you. Look for those. And most importantly, have each other's back right now. That is so important. If you see that nurse take off their mask and make a poor decision, stop them and say, hey, wait a second, why are you doing that? Have your fellow workers back right now. It's never been more important. Yes. Renee, I want to thank you so much today. And I want to thank all of you for joining our conversation today. And we look forward to seeing you out there. And more than anything, if you feel bad, if you feel concerned about your own level of burnout, seek some help.
Yes, please do. Thank you for having me, Perry.
Thanks. Bye-bye.